Hey everyone, Nurse Cat Pink coming to you this time about sore nipples. So again, kind of going to some breastfeeding topics. If you just started breastfeeding and your nipples hurt like crazy, just know it's not supposed to be like that, and it does not have to be like that. I took the time on my day off from being a nurse practitioner, breast expert, baby lover, just to come to all of you and let those of you know who have this question of like, should this hurt? Should my nipples be bleeding? Or like, they look fine, but they're just in a lot of pain. It should not hurt. You should actually feel, I mean, if you want to breastfeed, if it's right for you, and if the baby's latched properly, you will feel comfortable. If you don't feel comfortable and you've still had a lactation consultant, multiple lactation consultants, nurses, your midwife, like everyone's checked the latch, they've all said it's a good latch. You've had someone who's an expert in infant oral anatomy, so like what their mouth is like and how it should be for comfortable feeding. If you've had that type of nurse or doctor check out your baby, they've listened to the sucking, they don't hear any like pops or clicks during sucking, they see your baby regularly swallowing, you can see the baby swallowing or hear the baby swallowing. If all of that is in place and it still hurts, or you still think there's a problem with the latch, at that point, definitely talk to a professional, a lactation consultant who's trained in assessing the baby's suck. So pretty much any lactation nurse who's had a decent amount of experience will be able to do this. And it's something that you can kind of like grit your teeth and try to get through, or you might be at the point of you're like, I'm ready to give up. Definitely check out my video of like, should I stop breastfeeding? I think it's called When Should I Stop Breastfeeding? What Your Doctor Doesn't Tell You, to get the full nitty gritty on that topic. But for now, just thinking just about like nipple pain, nipple soreness. If your nipples hurt, know that if the latch is good, meaning like a proper baby's mouth on the breast, that you might have some like really mild soreness, but not pain, not a pinching pain. And so if you're at the point where you've had everybody check, everyone says the latch is good, but it still hurts, at that point, it might be worth doing that deep dive into like mental, emotional, spiritual, like, am I okay? Am I physically okay? Am I mentally okay? Am I emotionally okay with continuing? Or is this something that's not right for me? And again, because there are some people out there who will still feel uncomfortable with breastfeeding even when the latch is great. And I'll post some links to show you what a good latch looks like in case you've not seen that before. But if it still hurts, and especially if the skin is fine, like the skin doesn't look bent out of shape, like a lipstick shaped nipple, there's no bleeding, there's no cracking. Like if all your providers, nurses, doctors, midwives are telling you the nipples look normal and okay right after feeding, in between feeds, then that's when you really do a deep dive into yourself of like, okay, what else could be going on that like physically it looks fine, but it still doesn't feel okay to me to be breastfeeding. And everyone's telling me it's okay, but it doesn't feel okay. That's the deep dive time. Watch the first video I posted like I think 4 days ago. The other thing is if it's just like your skin is looking broken, not just, it's awful and sucks when that happens, but if your skin is broken, if it's cracked, if it's bleeding, or if it looks even like bent out of shape after the baby feeds, like the shape of a lipstick with the slant on the top of the nipple, then that's a sign that you still need some help with breastfeeding from a lactation expert, a breastfeeding expert. These nurses, lactation nurses, not only do they have their full education in nursing for years and years, just studying how to support people medically, but when you meet one in a postpartum hospital or in a pediatric clinic, they also have extensive experience taking care of babies and mamas and parents, and they know their stuff. And it's really important, like if you don't have access to that, like call your local WIC office or your state maternal child support center in the state that you're in or the county you're in to see what you can get for free if you can't pay for it, if your insurance doesn't pay for it. Luckily, a lot of insurances are paying for lactation consulting these days, so you can even have someone maybe even come to your house or do a Zoom session with you one-on-one, like a lactation nurse, and a lot of insurances are covering it. But then you have lactation people like me who we're not messing with insurance, we're just taking like coaching consults. So I am going to start making some coaching available, and due to legal restrictions, I will not be serving you as a nurse or a nurse practitioner, even though I'm both of those things. I will be seeing you exclusively for something I've invented pretty much, which is just coaching you, helping you figure out what's going on. If you feel like you've had all the physical things addressed and all of your healthcare providers are telling you one thing, like they're telling you you're okay or it's okay, it looks fine, you're doing fine, but you don't feel okay inside of yourself, or you know something's off, and you just want some coaching on how to navigate the health system, how to navigate women's health, how to kind of self-advocate, and how to wrap your mind around that difference between what people are telling you in the health field and what you're feeling. That's where I come in. So in the next couple of weeks, I'll be opening a website where you can book coaching with me. That's just an aside. So I think you won't need that. You don't need that coaching if you already have support. If you are feeling secure in what you're doing with your body, with, you know, if you're breastfeeding, with you and your breastfeeding and your baby, if you're feeling even 10% confident in what's going on. No one feels 100% confident when they first have a baby, I'll tell you that right now. But if you're feeling even 10% confident, that if you really hunker down and stay dedicated to whatever feeding method it is you want, you can get through it with support. That's key, to have support from lactation professionals or friends or family who have gone through this before, that type of thing. So hopefully this video isn't too jittery. I thought I would do a standing video just to get up and move around, but definitely the main thing here is if your nipples are hurting, there is that myth out there that unfortunately some pediatricians or kid doctors or nurses are under the wrong impression that it's normal for your nipples to hurt, and they'll tell you that, and that's just not true. The nipples should not be cracked or bleeding or misshapen after you breastfeed. You're gonna need extra help if that's the case. If you're still in the hospital, flag down your nurse. If you're watching this before you have your baby, know that if you're in a major medical system, like most urban hospitals, I think all, have at least one lactation consultant on staff in their labor, delivery, postpartum units and their NICU, so their neonatal intensive care units, at least on the daytime weekdays, if not 24 hours. So definitely make sure, like, advocate for yourself to get on the list of who the lactation consultant will see when they do their rounds the next day, and tell your doctor and nurse that you can't leave the hospital until you get help with breastfeeding, and then they'll take you seriously. So usually a lot of hospitals will just make sure that happens no matter what, but there's some where they're understaffed, or especially now with, you know, the pandemic and everything, people are overworked, and there's patients that are falling through the cracks, which is sad and scary, and I don't want that to happen. I want you to advocate for yourself to be seen, and all of you out there, like people who are baby advocates, breastfeeding advocates, or any type of feeding advocates, healthcare advocates, women's health advocates, like all of you who support us healthcare professionals, even if you don't do it yourself as a patient, the more you advocate for staffing at hospitals and clinics to be centered around women's health, gender minority health, hormone health, baby health, the more that helps us as health professionals to get administrative leaders to hire more of us to give you good staffing, and to make sure we can see everybody like you who needs the help that they really deserve. And until then, until everyone has complete 100% access to help when their nipples hurt, when they're breastfeeding, or any other women's health, gendered health, baby health, family health concern, until then I will be making in-depth videos and giving other resources for free to help bring that education to you that you couldn't otherwise access. The education that I wish, the information that I wish every single one of my patients had to make health decisions, like stopping breastfeeding, or starting or deciding to breastfeed, or to switch to a bottle, or that type of thing, anything that goes on with your body, right? You deserve to have the full information, and it deserves to be accessible and not cost you a ton of money. And then for folks that want extra information, there is a lot of value that professionals like me bring to the system. So for a fee, you can meet and get extra coaching on top of the healthcare support you've already had from people like me who are doing coaching, and we have that professional background. And then just generating a lot of free content. So thanks for watching. Know that it is not normal to have messed up, ripped up, painful nipples. It's a myth that it should hurt. When you have a proper latch, when the baby's mouth is on the breast in the right way, it should only feel like pulling and not pain. And then again, like seeing that and what that should look like is super helpful for breastfeeding parents. So I'm gonna link that below. Definitely subscribe and hit the like button if you enjoyed this video so I can get your feedback, and leave me a comment if you have questions. All right, take care, bye. Nurse Cat Pink signing out.